Hey there, this is Dr. Evan Osar of Integrative Movement Insider. Welcome to this special three-part video series on the best core exercise for working with individuals that have low back pain. I put together this special three-part video series because so many of you are working with clients and individuals that have low back pain and you're looking for safe and effective strategies for working with them. I also put it together because so many of my clients and patients, they ask us, what's the best core exercise I can do for my low back pain? So in discussing this idea with my patients and clients, I decided it's important that we get this information out. So around the idea of exercise, the best core exercise for low back pain, we have to discuss what the biggest myth is. The biggest myth surrounding the best core exercise or exercises and low back pain is that it's not about the weak core. Too many of our clients and patients have been told that they have a weak core, and that's what's contributing to their low back pain. And after 17 years in practice and working with thousands of individuals with low back pain, I've come to realize it's not about core weakness. Because if that were true, then our gyms would not have any individuals that have low back pain, because people are in there strengthening their core all the time. All the people that are going through these boot camps and training programs, all our athletes that are strong athletes will never experience low back pain because they're all strong. And the clients and patients we see, that even our older clients, our baby boomers, our seniors, the individuals that don't work out, they don't have a weak core. What is it? It's really about the strategy they are using. And most of these individuals with low back pain have a non-optimal strategy for controlling and using their core muscles. So how and what is the best exercise, and how do we develop a more optimal strategy? Well, it really comes down to best practices. And best practices are those things that individuals in every industry, the Pilates industry, the yoga industry, the health and fitness industry, the training, conditioning, the rehab industry, what are these individuals doing that helps them most effectively work with their clients and helps develop optimal results? Well, it really comes down to three things. After studying and working with some of the most intelligent individuals in the health and fitness fields, we've really boiled down the information into three important components. And we call these the principles of the integrative movement system, ABCs: alignment, breathing, and control. We must teach these individuals to align their thoracolpelvic cylinder, or their core, their thorax over top their pelvis. We must teach them to align the pelvis in a neutral position, to maintain the optimal curves, that cervical lordosis, thoracic kyphosis, and lumbar lordosis. We must teach them breathing, that three-dimensional breathing that helps stabilize and equalize the pressures internally so they can maintain this position. That it's not about strength, it's about regulating internal pressures. And then C, control. We must teach them how to use the deeper muscles with the more superficial muscles to control the myofascial, use the myofascial system to control the alignment and breathing through whatever exercises that they want and need to do. So align the thoracolpelvic cylinder, breathe to create the proper internal pressure to stabilize and decompress that thoracolpelvic cylinder. C, use that myofascial system to control that alignment and breathing through all the fundamental patterns, whether they're pushing, pulling, squatting, lunging, bending, and or rotating. In video 2 of this series, we'll look at one of the most important go-to assessments that we use to distinguish and differentiate between strength and strategy. Is it a strength issue or is it a strategy issue? We'll go into that in the next video so you can start to tell your clients with confidence, do you have a strength issue or do you really have a non-optimal strategy that's leading and contributing to your low back pain? In the third video, we're going to go into how do we use these concepts of alignment, breathing, and control and develop the exercises that we use with our clients and patients to help them maintain and control their low back, so that the best exercise that you use is the one that helps them maintain alignment, breathing, and control. So we'll show you how to develop a more optimal strategy for those clients that need it in video 2, and it will carry into the higher level progressions in video 3. So you feel confident in working with clients that may come to you that either have and or may experience low back pain in the future. So this is Dr. Evan Osar of Integrative Movement Insider, or IMI. We'll catch you in video 2. Stay tuned. If you found this information useful, please forward it to a friend or colleague, and we'll catch you next time.